Well, guys, how are you? Today we will see about the nerves of bodiole and plexuses. So we will discuss about this. In this course or in this chapter, we will see about all plexuses, all four type of plexuses. And how where this plexus emerge from, also will be discussed. So we will see nerves of bodiole like thoracic nerves and plexuses in this way. So this is lecture outline. In this course we will see about spinal nerves, 31 pair of spinal nerves, spinal ganglia, cervical plexus, brachial plexus, lumbar plexus, sacral plexus. There is also another plexus which is known as coccygeal plexus, which is made up of S4 and S5. So this major plexus also will be discussed, and this is an objective. So nerves of bodiole and plexus, division of the nervous system. Topographically, structurally can be divided into two. Nervous system divided into two. The one is CNS, central nervous system, and the other is peripheral nervous system. Central nervous system includes brain and spinal cord, and peripheral nervous system includes 12 pairs of cranial nerves and 31 pairs of spinal nerves. These spinal nerves arise from the spinal cord, and functionally we can divide nervous system into two. The one is somatic nervous system, this is voluntary, and the other is autonomic nervous system, and this is involuntary. And autonomic nervous system in turn can be divided into two: sympathetic nervous system and parasympathetic nervous system. Sympathetic nervous system stimulates when there is fight and flight, and parasympathetic nervous system is when there is rest and relaxation. So we do have two types of cells. The one is neuron, and the other supportive cells are called neuroglia. So this is an introduction part. So this is the brain, this is spinal cord, so in together they are CNS, and this is spinal nerves which arise from the spinal cord, and this is ganglia. So ganglia with nerves can be considered as peripheral nervous system, and nervous system can be divided into central and peripheral. Central is brain and spinal cord, peripheral is divided into somatic nervous system and autonomic nervous system. Somatic nervous system will divide into afferent nerves and efferent nerves. Afferent is sensory, efferent is motor. Autonomic nervous system will further divide into afferent nerves and efferent nerves. Afferent is sensory, efferent is motor. Motor nerves, or these efferent nerves, can be divided into parasympathetic nervous system and sympathetic nervous system. So our concern is about spinal nerves and their plexuses. So we do have 31 pairs of spinal nerves. So among these, 8 is cervical nerves from T1 and up to C8, and 12 is thoracic nerves from T1 to T12, and 5 is five are lumbar nerves, which is from lumbar 1 up to lumbar 5, and this is cervical nerves, this is thoracic nerves, and this is lumbar, and this is sacral and coccygeal. So 5 is lumbar and sacral, 5 is sacral from sacral 1 up to sacral 5, and 1 is coccygeal. So mixed nerves attached to spinal cord. So these nerves arise from the spinal cord, and at their origin the spinal nerve can be divided into two roots. The one is anterior root, the other is posterior root, or we can say anterior can be ventral and posterior can be named as dorsal. So this is this is a spinal, this is thoracic, astral-12, and this is lumbar, and this is sacral. Finally there is coccygeal. So from this tells us how the nerves are emerged in relation to the bones, their corresponding bones. For instance, how C1 nerve is passed through, whether it's above C1 or below C1, tells us just like this. And also this is cervical plexus, this is brachial plexus, and this is an enlargement which is called cervical enlargement, and this is an enlargement which is called lumbar enlargement, and this is so at its origin there is a root. This root can be ventral root and dorsal root. Ventral root means composed of motor fibers, These motor fibers is composed of motor fibers, and ventral root is composed of axons of nerve cells in the anterior horn and lateral horn. So axons of the lateral horn plus anterior horn will give us motor fibers. Anterior horn is made up of somatic motor, whereas lateral horn is made up of from the visceral motor. These two motors are considered as ventral root, and posterior or dorsal root is also composed of sensory fibers. So this root contains swelling, large swelling. This swelling is known as posterior root ganglia or dorsal root ganglia, where cell bodies of sensory neuron are located. So for instance, cell bodies in the CNS can be named as nuclei, and cell body outside CNS is known as ganglia. So sensory cell bodies of sensory neuron is known as ganglia. So spinal nerve is formed as fibers from posterior and anterior roots, and converge and emerge through an intervertebral foramen. So spinal cord is found in the vertebral foramen, but spinal nerve, this is a combination of anterior and posterior root, is found in the intervertebral foramen. So let me show you here. This is section of spinal cord, transverse section of spinal cord. So this is areas which is known as, this is anterior horn. So anterior horn is made up of somatic motor, and this is a lateral horn which is made up of visceral motor, and these two are it is a posterior horn, so it is made up of somatic sensory and visceral sensory. Somatic sensory and visceral sensory. And next to that, these two things will lateral and visceral will form ventral root, and this the posterior two is forms sensory, dorsal root. So dorsal root contains only sensory fibers, whereas ventral root contains only motor fibers in this case. So this is section of spinal cord. So this is anterior root, this is posterior root. It has swelling. This is known as ganglia, sensory ganglia. So after this they will fuse together. So this is short cord is known as spinal nerve. This is spinal nerve. So after that, so as I told you, visceral sensory and somatic sensory will form this dorsal root. Visceral motor and somatic motor will form this ventral root. So this is spinal nerve because of short cord. So short cord. After that, they will cross each other, and they will form mixed nerve. Sensory, they will form rami. Rami will divide further into two. The one is anterior rami, the other is posterior rami. So anterior rami and posterior rami will contain mixed nerves, both sensory and motor nerves. So the spinal nerve trunk is a very short trunk that divides into two rami. The one is anterior rami, the other is posterior rami. So when we see dorsal or posterior, posterior rami, we can say that dorsal posterior ramus, it contains motor and sensory fibers that is mixed, and supply the muscle and the skin of the back of the trunk. They will directly supply the skin and the muscles of the back of the trunk. Whereas ventral ramus having two very important functions. The one is supply the muscle and the skin on anterolateral side of the skin, the trunk. The one is they will supply the muscles and skins which is found on the anterolateral side of the trunk. But the second one is that all anterior rami will form a plexus and will form the plexuses. So and innervate the upper limb and the lower limb. So the ventral rami one is supply the anterolateral side of the trunk. The other is they will join together and they will form plexuses. They will form four major types of plexuses, and they will supply around the shoulder area and the upper limb, and around the abdomen and the lower limb they will supply. So plexus comes from the ventral ramus or ventral rami. And so this is as we shown that this is dorsal root, ventral root, this is spinal nerve, and after that roots, this is two roots, this is two rami. This is post dorsal rami, this is ventral rami. So they are mixed. Both contains sensory and motor nerves. So the motor one will go into muscle, and the sensory one or the cutaneous one will go into the skin. So now we have seen the nerves how arise from the spinal cord. Now we will just explain about the plexuses, the nerve plexuses. There is 5 plexuses, but majorly we do have 4 types of plexuses. The one is cervical plexus, the other is brachial plexus, and lumbar plexus, and sacral plexus. And plexus are formed from the ventral rami. So except for thoracic nerves, the ventral rami of spinal nerve combine and then split again as network of nerves. This network of nerves is known as plexus. So from the region, thoracic nerves cannot be they are not participating in the plexus formation. But from among thoracic nerves, T1 and T12 are participating in the plexus formation. T1 is for brachial plexus, and T12, some fibers of T12 is participate for lumbar plexus formation. But when we see it as a general, thoracic nerves are not participating in plexus formation. But specifically, some fibers of T12 and T1 is participate in plexus formation for other groups or for other plexuses. So there are 4 plexuses of spinal nerves. This is 4. So we will see these 4 deeply. How these plexuses are formed, their roots, their divisions, and how what type of nerve these plexuses will supply us or will provide us. So we will see this one. So the first plexus is known as cervical plexus. Cervical plexus is composed of C1 and C4 and some portion of C5. And cervical plexus found deep in the neck under sternocleidomastoid muscle, and innervates the skin and muscles of the neck, as well as the posterior head and the shoulder. Has this type of function. So cervical plexus has branches. The first branch is group of branches, cutaneous branch and motor branch. When we see cutaneous branch, there is lesser occipital, greater auricular, transverse cervical nerve, and supraclavicular nerve. Lesser occipital is mainly composed from C2 root. Sometimes some books say that arise from C2 and C3, and greater auricular is arise from C2 and C3, and transverse cervical nerve is arise from C2 and C3, whereas supraclavicular nerve is arise from C3 and C4. So C3 and C4 are roots of cervical plexus. So they are arise from these parts, and they all are cutaneous or sensory. They are supplying skins. And the other is motor branches. We can divide motor branches into 3. The first motor nerve is pharynx nerve. Pharynx nerve is arise from the 3 roots, from C3, C4, and C5. This nerve is motor supply to the diaphragm, whereas there is also branch to infrahyoid muscles. So from that supply infrahyoid muscles. So this is ansa cervicalis. Ansa cervicalis is a loop nerve. So this is a motor branch to all infrahyoid muscles except thyrohyoid muscle. Ansa cervicalis is supplied infrahyoid muscle. So whereas thyrohyoid muscle is supplied by C1 nerve, a separate C1 nerve, which is carried by hypoglossal nerve, So C1 that is carried by hypoglossal nerve supplies to 2 muscles. The one is thyrohyoid muscle and geniohyoid muscle. So there is pharynx nerve motor and ansa cervicalis motor, and also there are other muscular and segmental branches which is they supply us singly like C1. So this is branches. So this is from up to the half of C5 is above this one is cervical plexus, and below this one is brachial plexus, and this is ganglia. cervical ganglia. So this is internal common carotid, this is internal and external carotid artery. This is largest one is superior cervical ganglia, and this is middle cervical ganglia, and this is inferior cervical ganglia. But this superior cervical ganglia communicate and transmit impulses through these gray communicants. This is gray communicants and pass impulses to C2, C3 and C4, whereas middle cervical ganglia, this is gray communicants. Before this one we can say white communicant, but this one gray communicants. So through this gray communicants they will pass impulses to the C6, or the impulse is carried by C6 and C5. The other is inferior cervical ganglion. Inferior cervical ganglion is carried by C7 and C8. So this is cervical plexus. This is a point of cervical plexus. So this one is greater auricular, which is above the ear, in front of the ear. This is lesser occipital, behind the ear, supplies the skin behind the ear, whereas this is transverse cervical, which is comes horizontally or transversely into the neck and supplies the skin, whereas this is supraclavicular nerve, which comes into three branches. Supraclavicular will divide into three. The one is posterior branch, this is middle branch, this is anterior branch. So these two branches supplies around clavicular area, whereas posterior one is around shoulder area. It supplies shoulder area. So this is cervical plexus. So as we have mentioned, this is ventral rami of C2 and C3. That's lesser occipital, mainly C2. So lesser occipital supplies the skin on the posterolateral aspect of the neck. Greater auricular supplies the skin on the skin of the ear, the skin over the parotid gland, that means in front of the ear. And transverse cervical supplies the skin on the anterior and lateral aspect of the neck. And supraclavicular having three branches, anterior, middle and posterior branch. Supraclavicular supplies the skin of the shoulder and clavicular region. And ansa cervicalis having two roots, superior and inferior root. Superior root is made up of C1 and inferior root is made up of C2 and C3. And they supply infrahyoid muscles like omohyoid, superior belly of omohyoid, inferior belly of omohyoid, and sternohyoid muscle and sternothyroid muscle. But genohyoid and thyrohyoid muscles is supplied by deep muscle of the neck, or C1 nerves, which is carried by hypoglossal nerve. And some portion of scalene, levator, scapula, trapezius, sternocleidomastoid muscles is innervated by some segmental branches. And the last one is the mode pharynx. Pharynx is the sole motor for diaphragm. So arise from C3 to C5, the portion of C5, C3, C4, and portion of C5. So this is an important picture. So this is cervical plexus, this is anterior rami, this one is posterior rami. So occipital and greater occipital like this, that is the posterior rami, whereas this one is anterior rami. So this is C1 is carried by hypoglossal nerve. So at the end they will divide into two. At the end there is two branches. This one is a branch which forms superior roots of the ansa cervicalis, whereas this one is a branch which will divide into two branches. The one is branch to genohyoid muscle, and the other is branch to thyrohyoid muscle. So the other branch is participating in that one. So the other is C2 and C3. C2 and C3 is also forms the inferior root of ansa cervicalis. So ansa cervicalis is formed from C1 to C3. The other is C2 and C3. From C2 there is lesser occipital nerve. C2 and C3 there is greater auricular nerve, and C2 and C3 there is also transverse cervical nerve, and C3 and C4 there is supraclavicular nerve. These all are cutaneous and ventral or anterior rami, and pharynx is made up of 3 and 4, 5. And this is how they go. So this is greater auricular, this is lesser occipital, this is transverse cervical. Transverse, they are going to transversely to the supplies anterolateral part of the neck, and this is supraclavicular. So from this boundary, anterior to this boundary, they are ventral rami, and posterior to this one is dorsal rami. And having this concept, to make this picture to be clear, this is lesser occipital nerve, this is greater auricular nerve, this is accessory nerve, cranial nerve 11, this is transverse cervical nerve. Transverse cervical nerve will divide further into superior and inferior branch, and this is and also furtherly this is supraclavicular nerve. So this is anterior branch, middle branch, and posterior branch. And the nerve loop lying in front of common carotid artery is ansa cervicalis. Ansa means loop. So ansa cervicalis have two roots. The one is superior root, the other is inferior root. Superior root is made up of fibers from C1, as we have seen, and inferior roots arise from C2 and C3. So ansa cervicalis supply all infrahyoid muscle except thyrohyoid muscle, which is supplied from anterior rami of C1, that is carried by hypoglossal nerve. And after supplying this thyroid muscle, they will branch into two, and the one is that forms superior root of ansa cervicalis, the other is will go into that. And C1 is carried by hypoglossal nerve and forms the superior root, and C2 and C3 are from cervical plexus and form inferior root. Ansa cervicalis joins the superior and inferior root and gives off major branch to strap muscles, that is infrahyoid muscles. Ansa cervicalis lies lateral to internal jugular vein and the carotid sheath. So this is a very important picture. This is C1, so it is carried by hypoglossal nerve, cranial nerve T1. So they will go into the tongue muscles, that is hypoglossal nerve, but C1 is go into this and will divide into two branches. The one is that branch which forms the superior root of, or the upper root of ansa cervicalis. The other branches will divide further into two. The one branch, superior branch, is a branch to genohyoid muscle, and the other is a branch to thyrohyoid muscle. And finally, C2 and C3 will merge together and gives us inferior root. C1 gives us superior root. So this is known as loop of ansa cervicalis. From this loop, there is four branches. The one is branch to superior belly of omohyoid. The second one is branch to sternothyroid muscle. The other is branch to sternohyoid muscle, and branch to inferior belly of omohyoid. This is branches of ansa cervicalis, or branch of ansa cervicalis, which supplies four type of muscle, or four type of muscle. If you consider superior and inferior belly, you can say four type of muscle. So this is about the ansa cervicalis, and this is the loop of ansa cervicalis here. And finally, this is, by the way, if you want to draw cervical plexus, you have to follow this step. The one is from CC1. From CC1, they will give two branches. This is will go into genohyoid and thyrohyoid. This one is a branch of C1, which forms the superior root of ansa cervicalis, whereas from C2 and from C3 they will form inferior root of ansa cervicalis. So this is loop of ansa cervicalis. So having this concept, this is known as ansa cervicalis in general. And from the C2 there is lesser occipital nerve. From C2 and C3 there is greater auricular nerve, and and also from C3, from C2 and C3 this is C2, and from C3 they will form transverse cervical nerve, and from C3 and from C4 they will form into supraclavicular nerve, and from C3 1, from C4 2, from 2C5 they will form pharynx nerve. So you can draw just like this. The other is this is similar with this is root, so this is division. The second type of plexus is the brachial plexus. This plexus is arise from C5 to thoracic wall. So this forms brachial plexus, found partly in the neck and partly in the axilla. The plexus itself found in the neck and partly in the axilla, and innervate one is the upper limb, shoulder and neck muscles. So having participation in the three regions. The one is from the shoulder, innervates the upper limb, shoulder and neck muscles, and structurally divide into roots, trunks, divisions and cords. So let me show you about this one. First, there is roots here. From this root there is C5 here, C5. There is C6 here, C6. There is C7 here, C7. So this is C7, C8, and this is T1. This is a root. So from this root, C5 and C6 will form trunk. This trunk is known as superior trunk, and only C7 will form middle trunk, and C8 and T1 will form inferior trunk. So this is roots will come into trunks. So this trunk will have three trunk: upper trunk, middle and inferior trunk. The upper trunk will divide into divisions. So anterior division and posterior division. This one also anterior division and posterior division. This one also anterior and posterior division. We do have three anterior and three posterior divisions. And the division will divide into cords. So anterior division of the upper trunk and anterior division of the middle trunk will form into lateral cord. And anterior division of the lower trunk. The anterior division of the lower trunk will form middle cord. And finally, from the posterior division of the upper trunk, the middle trunk, the inferior trunk, the three posterior branch will form into posterior trunk. So we produce three trunks: lateral, medial and posterior trunk. And cord, lateral cord, middle cord and posterior cord. And the lateral cord will give into musculocutaneous nerve, and also the lateral cord also participate in formation, and the median cord will give into ulnar nerve, and also the median nerve will contribute here. So this is ulnar nerve, this is musculocutaneous nerve. Finally, the contribution from lateral cord and medial cord, there is one nerve. This is known as median nerve. This is M-shaped, musculocutaneous, median and ulnar nerve. And finally, this is three muscles. Finally, the posterior cord will give two nerves. The one is axillary nerve, the other is radial nerve. So at the end there are 5 nerves. So 5 nerves are the terminal nerves of brachial plexus. So let me see further. Brachial plexus will give into branches in the neck. The one is through communicating gray rami communicants. So middle cervical sympathetic ganglia through 2C5 and C6, inferior cervical sympathetic ganglia to C7 and 8, first thoracic sympathetic ganglia to T1. And if you consider this is cervical plexus, superior cervical sympathetic ganglia to C1 to C4. So there will also muscular branches in the upper limb and diaphragm. So C5 will participate in the pharynx nerve, and also C5 will contribute into dorsal scapular nerve, which supplies levator scapula, and C5 and 6 will give us nerve to subclavius and suprascapular nerve. So suprascapular nerve and nerve to subclavius arise from C5 C6. C5 to C7 is will give long thoracic nerve. This long thoracic nerve will supply serratus anterior. Finally, this is we have seen, and this is roots, ventral rami roots. This is C5, this is C6. So this is gives us upper trunk, and C7 gives us middle trunk, and C8 and T1 is lower trunk. We have seen lateral. So upper trunk will divide into anterior and posterior division, middle trunk will divide into anterior and posterior division, lower trunk will divide into anterior and posterior division. So anterior divisions of upper and middle trunk will give us lateral cord, and anterior divisions of the lower trunk will give us middle cord, and posterior. The three posterior branches of the upper, middle and lower trunk will give us posterior cord. So lateral cord will give us musculocutaneous nerve and will give branch to the medial nerve. And also medial nerve will give branch to the medial nerve and will give branch to ulnar nerve. So this forms M shape. So this one is musculocutaneous, this is medial nerve, this is ulnar nerve, which is a contribution of lateral and medial cord. And the posterior cord will divide into two nerves. So one is radial and axillary nerve. So musculocutaneous, median, ulnar, radial and axillary are considered as peripheral or terminal branches. So furtherly, this is brachial plexus distribution, C5, C6, C7, C8. This is trunk, and this is division, this is cord, and this is terminal branches. So musculocutaneous nerve is arise from C5, C6 and C7. Axillary nerve from C5 and C6, and radial nerve arise from roots of C5, 6, 7, 8 and T1, and medial nerve arise from C5, 6, 7, 8 and T1, ulnar nerve from C7, 8 and T1. This is roots, and from this cord, this is lateral pectoral nerve. There are other nerves which arise from the plexus. This is terminal branches. Other nerves which arise from the cords and truncus divisions which arise from this area. So this is known as upper scapular, upper branch to upper scapular, upper subscapular, thoracodorsal, and lower subscapular. And this one is medial pectoral nerve, and this is long thoracic nerve, and other branches also will arise from this one. This is pharynx nerve, and this is also the same thing. And the nerves which arise from brachial plexus are the one is musculocutaneous nerve. Musculocutaneous nerve will give muscular branch and cutaneous branch. The muscular branch musculocutaneous nerve will give to three muscles anterior compartment of the arm. So biceps brachii, brachialis muscle, and coracobrachialis is supplied by muscular branch or motor branch of musculocutaneous nerve, and the other skin on the anterolateral forearm is supplied by cutaneous nerve, cutaneous branch. So from this musculocutaneous nerve is this one. Musculocutaneous nerve is this one. So this is musculocutaneous nerve. Musculocutaneous nerve is found between biceps brachii and coracobrachialis and brachialis muscle. So this is cutaneous nerve, the arm. Cutaneous nerve is from the arm, whereas muscular branch is from the arm, So anterolateral side of the forearm is supplied by musculocutaneous nerve. And finally, the second type of nerve is medial nerve. Medial nerve also will give two branches, muscular branch and cutaneous branch. The muscular branch of medial nerve supplies all flexor muscles of the forearm or anterior groups of the forearm, except flexor carpiulnaris and ulnar two heads of flexor digitarum profundus, because flexor carpiulnaris and ulnar two heads of flexor digitarum profundus is supplied by ulnar nerve. Except these two parts, others are supplied by the medial nerve, and also the first and second lumbricalis is supplied by medial nerve. And also cutaneous nerve, the cutaneous branch or cutaneous nerve of medial nerve supplies the skin on the palm side of the first, the second, the third, and half of the fourth finger. This is the second. The palm side means this is the first, second, the third, and fourth part is supplied by medial nerve, cutaneous branch. But the half part of the fourth finger and the fifth finger is supplied by ulnar nerve, this cutaneous branch. So on the palm side, the majorly is the cutaneous nerve comes from majorly from medial nerve, and for 1.5 finger comes from the ulnar nerve. ulnar nerve. So the median nerve is this one found in the middle. So this is a distribution of the median nerve. Some part of like nail area is also supplied by median nerve, and the other ulnar nerve. Ulnar nerve is having, just like others, having muscular branch and cutaneous branch. Muscular branch is supplied flexor carpi ulnaris and ulnar to heads of flexor distalis profundus. Two. The others all interossei muscles. All interossei muscles. Interossei muscles are 8 interossei muscles, 4 dorsal interossei and 4 palmar interossei. So all 8 interossei muscles are supplied by ulnar nerve, and the medial to lumbricalis. The lateral to lumbricalis is supplied by median nerve, whereas the medial to lumbricalis is supplied by ulnar nerve. And all hypotenar muscles. Hypotenar means muscles which is found on the side of little finger. So all hypotenal muscles and adductor pollicis muscle is supplied by muscular branch or median nerve. Muscular branch of ulnar nerve. So this is median nerve, this is ulnar nerve, and this is musculocutaneous nerve. And cutaneous branch, the skin on the palm side of half of the fourth and the fifth finger. This is also we have discussed. And on the dorsal side, the fifth and half of the fourth finger. Similarly, fourth and half of the fourth and fifth finger anteriorly and posteriorly, or on the palm side or the dorsal side, supplied by ulnar nerve. This is on the dorsal side, this is on the palm side. Both are this is half. Both are supplied by ulnar nerve. And the fourth type of brachial plexus, branch of brachial plexus, is axillary nerve. Axillary nerve will have two branches, cutaneous branch and muscular branch. The cutaneous branch will give sensory nerve to the skin of the shoulder and shoulder joint, whereas the muscular branch is supplies to muscle, deltoid muscle and teres minor muscle. Deltoid muscle and teres minor muscle is supplied by axillary nerve. Axillary nerve comes from the roots of C5 and C6, and this is and the auxiliary nerve is not seen here. So auxiliary nerve is we will see later. Auxiliary nerve. So okay. And finally there is radial nerve. Radial nerve will divide into muscular branch and cutaneous branch. The muscular branch will give posterior muscles of the arm and forearm and hand. By the way, radial nerve supplies all muscles of the posterior arm, posterior forearm, posterior hand. All muscles are supplied by radial nerve. Cutaneous branch, the skin of the posterior lateral surface of the entire limb. In the hand, also the posterior lateral surface of all entire limb, all upper limb is supplied by cutaneous branch of radial nerve. But in the hand there is some difference. In the hand, dorsal side of first, second, third, half of fourth finger is supplied by radial nerve, meaning half of fourth finger. So half of fourth finger and fifth finger is since half of fourth finger and the fifth finger is supplied by radial nerve, so all others are supplied by radial. Half of the fourth finger and the fifth finger is supplied by ulnar nerve. So since half of the fourth finger and the fifth finger is supplied by ulnar nerve, all these are supplied by radial nerve. First, second, third, and half of fourth finger is supplied by radial nerve. Half of fourth and fifth finger is supplied by ulnar nerve. So this nerve is known as radial nerve. This radial nerve is passing through the radial groove. Radial groove is found the origins of lateral head of triceps brachii and the medial head of triceps brachii. So the medial head is below the radial groove and the lateral head is above the radial groove. So this is the radial groove area which is radial nerve is located. So this is all cutaneous nerves of the upper limb. Okay, all cutaneous nerves of the upper limb, whether they discussed here or undiscussed, all are found in this area. So these are either there are segmental cutaneous nerves, and otherwise what we have nerve like musculocutaneous nerve like that. All you can see how dorsal and palmar side of upper limb will supplied by how many nerves, how many cutaneous nerves. The other is injuries to brachial plexus. Brachial plexus became completely paralyzed only in severe injuries, but usually some parts of it are injured. It is injury that frequently occurs during delivery. This, if brachial plexus damage during delivery, we can call it brachial burst paralysis. 3 types of such paralysis are recognized. The one is whole arm paralysis. The second is Erb's palsy of the arm paralysis. Second is complex paralysis of forearm. So Erb's Duchenne paralysis or palsy is due to injury of nerves arising from C5 and C6 or upper trunk. Is injury due to these roots are known as Erb's Duchenne paralysis. And musculocutaneous nerve, axillary nerve, supraclavicular nerve to subclavius are injured in this case. It is the most common type of brachial plexus injury, characterized by paralysis, atrophy of the deltoid, flexor muscles, and the long spinator muscles, in which case flexion and supination are weakened and abduction of lateral rotation are lost. In this case, the position is waiter steep position. So babies which have this paralysis have position of waiter steep position. And Coulombics paralysis or Dejerine-Coulombics syndrome is due to injury of C8 and T1 or lower trunk. This is manifested as claw hand, a shape having like claw hand. And the other is causes. This is causes. You can read. And Behr's plexus can also be injured by compression. Example: crunch paralysis, Saturday night palsy, like this. If C7 is involved in it, leads to paralysis of triceps, weakness of extensor of the wrist, fingers. This weakness of extensor of the wrist and fingers is at this waist drop of radial nerve type. Now we will start about sympathetic trunk. Sympathetic trunk, longitudinal strands of autonomic nerve fibers associated with sympathetic ganglia, located on an anterolateral to the vertebral column. A trunk or sympathetic trunk in the neck have 3 pairs of cervical ganglia. The one is superior cervical ganglia, middle cervical ganglia, and inferior cervical cervical ganglia. So the ganglia receive preganglionic fiber from the superior thoracic spinal nerve and through white rami communicantes. These fibers leave from spinal cord through ventral root of thoracic spinal nerves. From this sympathetic trunk, fibers pass through cervical structures as postganglionic fiber in the cervical and spinal nerves. So this is a sympathetic trunk, or this is a preganglionic fibers. This is post-ganglionic fibers. This is ganglia. So this is synapse here. So this is preganglionic. This is post-ganglionic. Post-ganglionic fibers are directly going to viscera or organs. So this is the spinal cord. This is ganglia. So the sympathetic trunk from the base of the skull, to the tip of coccyx, where the 2 trunks join to form ganglion impar. The trunk continues upwards into the carotid canal as internal carotid nerve. The branch to the head run with arteries, especially with cephalic arterial plexus and internal and external carotid arteries. So we do have 3 types of ganglion in the neck or cervical ganglion. The one is inferior cervical ganglion. This represents fused ganglia of C7 and 8. inferior cervical ganglion, collection of the nerve cells at the level of superior border of the neck of the first rib and transverse course of C7. By the way, this is inferior cervical ganglion. So it is wrapped with first part of vertebral artery, mostly fused with the first thoracic ganglion, and to form the large ganglion called cervicothoracic ganglion or satellite ganglion. So the post-ganglionic fibers passes to C8, C7 and 8, heart, vertebral, plexus, and the vertebral artery. So this is about the inferior. The middle cervical ganglion represents the fused ganglia of C5 and C6. This is small at the level of transverse course of C6 on the anterior aspect of inferior thyroid artery. Post-ganglionic fibers passes to C5 and 6, heart, thyroid gland. And superior cervical gland represents the fused ganglia of C1 up to C4. It is the largest from the three. It measures up to 2-3 cm long at the level of atlas and axis bone. It is a landmark to locate sympathetic trunk in the neck because it is large. Post-ganglionic fibers pass along internal and external carotid arteries to the superior for cervical spinal nerve and to the heart. So heart is supplied by the three: superior, middle, inferior cervical ganglion. So this is a three. So this is distribution as a whole. So in the next video, lumbar plexus and sacral plexus will be presented. So don't forget to subscribe this channel to get the next videos. So in the part 2 of this part 2 of this plexus nerves, lumbar and sacral nerves will be presented. So have a nice time. Bye bye.